Okay, so I'd just like to take the time to introduce myself. My name is Tanya and I am a Medical Education Officer for the Riverland Academy of Clinical Excellence here in Berry. And I have the privilege to introduce Liza-Jane McBride to you all today. And thank you for giving us April's Grand Rounds, Lisa. So I'll just briefly introduce you. So Liza-Jane is the Chief Allied Health Officer for Queensland. She is an experienced physiotherapist with over 30 years of practice experience in the public and private sectors in Queensland and also overseas. Liza-Jane is an adjunct professor at the University of Queensland and the Queensland University of Technology. Her past publications and current research collaborations include a range of allied health workforce, education and service redesign projects. She is also the current Deputy Chair of the National Allied Health Allied Health Chief Officers and Advisors Committee. So thank you very much, Lisa. I'll let you take over.
Excellent. Thank you, Tanya.
Thank
you for the opportunity to come and present to the Riverland Academy of Excellence today. I will be discussing the development of the Rural Generalist Pathway for Allied Health Professions with a specific focus on Queensland Health's experience and learning. But before I start, I would like to acknowledge the traditional custodians of all of the lands on which we are all meeting today. I am joining from the country of the Jagera and Turrbal peoples of Meanjin, otherwise known as Brisbane, and I'd like to acknowledge and pay my respects to elders past, present and emerging, and extend that respect to all First Nations people that are in attendance today. Before we talk about Allied Health Rural Generalist Pathway, I think I should briefly describe the concept of rural generalism as it relates to the allied health professions. So rural generalist allied health professionals either possess or are developing a broad clinical competence in their profession, plus one or more areas of depths or special skills that are aligned to specific service priorities or community need. The rural generalists provide services to a large range of consumers for a wide breadth of clinical presentations and usually work across the age spectrum and in a variety of healthcare delivery settings, including inpatient, ambulatory teams and the community. They may also work across sectors, including health, disability, aged care, working in small teams and in interprofessional and inter-agency service models is actually quite common, and that requires a range of professional capabilities, including collaborative practice, service evaluation and planning, leadership, education and training, community engagement and cultural safety. I think really importantly, the term rural generalist should not be confused with a generic health worker that doesn't have a primary allied health qualification. A rural generalist is not some sort of strange hybrid of a physiotherapist with a social worker and a pharmacist. There is no regulatory mechanism for such a hybrid worker in Australia, and that is not the outcome of the Rural Generalist Pathway for Allied Health. So a rural generalist practices within their scope of their profession and training and within the policies of their employer. So the Allied Health Rural Generalist Pathway is an integrated workforce, service and education strategy that's designed to improve the outcomes and sustainability of rural and remote multi-professional teams. The pathway has three pillars: workforce policy and employment structures that engage and support allied health professionals to practice as rural generalists. And these jobs should align to the training and support requirements of rural generalist practitioners and facilitate progression through all career stages, from students through to highly experienced leaders in rural generalist practice. There is an education and training component that supports the development of clinical, professional and personal capabilities and competencies that are relevant to a rural generalist role, to their profession and to the rural communities that they serve. And there is service delivery models that support and engage allied health professionals to work at the top of their scope as rural generalists and to enable the practitioner and their team to implement innovative and effective solutions that address the challenges of delivering care across a wide breadth of clinical presentations and to geographically dispersed and culturally diverse populations. This is a simplified representation of the Queensland Health Allied Health Rural Generalist pathway, and it also outlines what I would suggest are the stages of a future mature national pathway that supports the Allied Health Rural Generalist workforce and their services, from pre-entry students through to service leaders and expert practitioners in a rural or remote setting. In the centre is the designated early career rural generalist training positions that support the critical entry to practice phase. We have over 10 years experience with these positions here in Queensland, and there are also examples from South Australia, other state health services, and a primary sector through a program that the Commonwealth funded between 2019 and 2024. Beyond the early career phase, the pathway needs to support experienced clinicians to become rural and remote leaders in clinical practice, management, education, and research. Queensland Health uses our Rural Generalist Leadership Development Program, the Rural and Remote Research Capacity Building Program, and our new First Nations Leadership Development Program to support this stage of the pathway. And I'll speak a little bit more about the Rural Generalist training positions and our Rural Generalist Leadership Development Program in a little bit more detail in a moment. The pathway's foundation, though, must be at the pre-entry stage when emerging clinicians are making career decisions. Queensland Health, in partnership with universities, the University Departments of Rural Health within Queensland, and other healthcare agencies, began trialling the Rural Immersion Placement Program, Allied Health, or RIPA as we call it, in 2023. Students need to apply for a RIPA placement. We want these placements to be special and sought after, and that is in fact what we are finding. It is highly competitive. The number of applications far exceeds the number of placements that we can provide. What RIPA does provide is a 10 to 15 week curated multi-setting placement that meets the needs of the student and university and reflects the generalist nature of rural and remote practice for that profession. The placement also includes accommodation, options for paid employment around or between placements, and social and sporting opportunities within the community. Findings from our early implementation are positive for attraction, student experience, and conversion to graduate recruitment, including into those rural generalist training positions. So the Rural Generalist Pathway is a sequence of connected programs that reflect the needs of practitioners at different development stages. It also needs multiple entry points. People come to rural practice at different times, and they need to be able to enter the pathway stage that is right for them. So now I'll talk a little bit more about the Rural Generalist training positions. These positions provide supportive entry to practice through development-focused employment conditions and a formal training program. The trainee and their team work on service and learning. The trainee and their team work on service improvement projects that produce tangible outcomes for clients and the community. Queensland Health has implemented more than 100 training positions since our initial trial in 2014, and we currently average between 30 and 35 trainees that are on the pathway at any given time. The training positions can be implemented in any of the 10 professions that you can see on the slide, and in any rural or remote location in Queensland. So from Torres Cape in the north through to Charleville out in the southwest. Since 2019, the Queensland implementation model has been a co-funded approach, with the hospital and health services responsible for redesigning an existing early career position into a rural generalist training position, including a specific allocation of 0.1 FTE for the development activities of the pathway. And then my office in the Department of Health provides an annual funding package to cover university fees and to offset the service costs of development and supervision inputs into the pathway. The statewide funding for these rural generalist training positions is embedded within our certified agreement that covers the allied health professionals within Queensland Health. So what do we know about the impact of the rural generalist training positions? A recent research evaluation in Queensland Health showed that trainees have more than 70% longer continuous service in rural and remote locations compared to matched early career employees that are not in the training positions. And this difference was statistically significant. The trainees stayed in their training location for an additional 22 weeks on average. And over 5 years, that would equate to around 3 fewer turnovers, 3 fewer service gaps or gaps in services, 3 fewer recruitment, relocation costs and orientations. So it's not just statistically significant, it is also organisationally significant for rural teams and communities. Evaluation studies from South Australia, led by Ali Dimmitt at Flinders University, and also from New South Wales, have shown a range of similar workforce benefits, including longer tenure, improved attraction, reduced vacancy-related service gaps. The Queensland evaluations have also illustrated service benefits from the trainees' service development training and the projects that they undertake. So this is things like new telehealth services or improved use of remote allied health assistance. In Queensland Health, the maximum direct and indirect costs for a local health service of implementing an established allied health position as a training position for the pathway was found to be $15,720 per year, which was inclusive of those university fees, the training and supervision time. Local costs were found to be similar in South Australia, with Ali's team finding it just over $18,000 per annum. And even when the centralised coordination and support resourcing for the system are also considered, Ali Dimmitt's team found a positive return on investment. So now I'll talk about the Queensland Health Rural Generalist Development Program. So this program commenced in 2019 in response to evaluation findings about our rural generalist training pathway that showed inadequate training opportunities for more senior and experienced allied health professionals, that this was hampering workforce and service development in our rural and remote teams. So participants complete a 12-month program that includes fully funded postgraduate studies in either health professional education, health services management or clinical leadership. Or if they are a former allied health rural generalist trainee person who's gone through the pathway, they can actually use the program to update their graduate diploma in rural generalist practice to a master's. The program also includes monthly group-based mentoring that features discussions with senior and executive leaders from across Queensland Health and leadership of a local service or workforce capacity building project. Our recent evaluations showed strong stakeholder support and positive local development outcomes from the program. But the real impact that I see is when I visit our health services. On a recent visit to one of our remote hospital and health services last year, I noted the strong influence of the leadership development program. At that time, the acting Chief Operating Officer, the Exec Director of Allied Health, both Allied Health clinical leads, the Director of Pharmacy, the Interprofessional Clinical Educator, and the Hospital and Health Service Director of Innovation, Improvement and Planning had all completed the Leadership Development Program. I think investing in senior leadership development can be transformative for a service and really provides ambitious allied health practitioners with the learning, networks and confidence to stay rural and to take on more senior roles that can influence their organisation and their community. So in summary, my key points on the development of the Allied Health Rural Generalist pathway to date are, I guess, firstly, that there is good quality evidence from Queensland, from South Australia and elsewhere that has clearly demonstrated that Allied Health Rural Generalist training positions are an effective, valued and cost-effective strategy for building rural and remote allied health workforce and service capacity and sustainability. We can be confident that this is a good strategy and a good investment for a system with an increasingly competitive workforce market that is characterised by significant allied health workforce maldistribution. Secondly, the progress and benefits that have been achieved have only been possible through extensive collaboration. So that's state and territory public health systems, university and UDRH partners, our rural workforce agencies, and peak bodies such as SARA, and primary sector providers, as well as a range of other agencies that have invested time, energy, and resources into its development. The Commonwealth has unfortunately ceased funding for the Allied Health Rural Generalist pathway in primary care last year, but continued progress at a national level and with our states and local services will require us to champion allied health rural generalism and the pivotal role that allied health professionals play in health services to continue to pool our learnings and work together. Finally, and pleasingly, allied health professionals are increasingly embracing rural generalism as part of their professional identity. The term was almost unknown in allied health a decade ago. We now have jobs advertised in Queensland Health and elsewhere as rural generalist podiatrist or rural generalist pharmacist. Research papers are investigating the practice of rural generalists as a distinct group within their allied health profession. And allied health professionals introduce themselves as rural generalists at conferences and in meetings and on LinkedIn. Like medicine before us, Australia is leading the development of rural generalist scope and identity for the allied health professions. And we see this as vital to address the challenges of specialisation and subspecialisation in health systems and professions and to ensure sustainability of rural and remote healthcare. My office is always keen to engage and collaborate with other agencies to support the proliferation of the Allied Health Rural Generalist pathway. We publish a range of guides and reports and are very happy to share our learnings. You can visit our website via the link or the QR code for more information on how we've implemented the Allied Health Rural Generalist pathway within Queensland Health, and also for some information on our other rural and remote programs. So thank you. Let's stop sharing. Tanya.
Thank you so much, Lisa. That was very interesting. Thank you for taking the time to present to us today. And I'd just like to open the floor up to anyone who has any questions for Lisa.
Elaine.
Yes, Elaine.
It's not really a question. It's more a matter of stretching the envelope. So at the recent SARA conference in November last year, there was a lot of discussion about this, and I see this as a great opportunity for Riverland Mallee Coorong to lead the way, really. Although there's been placements in South Australia, they've been centrally coordinated, and I think we can do it without that. And so certainly I noticed that Wayne's online, which is great. Wayne and I are discussing that, but I guess the thing that I really wanted to say for the people who weren't at that conference, Paul Worley gave a fantastic keynote speech where he talked about shearing the whole sheep. So we need the whole pathway. So we've now got local allied health courses. We need, if we're going to have a workforce pipeline that's effective and sustainable, we need to be addressing issues all the way along and giving people a pathway and a career pathway that's local. So I thank you very much, Liza-Jane, and I also thank you constantly for the generosity of Queensland Health in sharing all of the resources that you developed. Many years ago, I calmly borrowed your allied health professional enhancement program and introduced it in South Australia, and it's still running. But yeah, so Queensland Health's very generous, and we're very grateful for that.
Thanks, Elaine. And yeah, very happy if afterwards people want to reach out, if you've sort of had a think and a bit of a mull about things. But you're absolutely right, Elaine, like it's that whole continuum. So I guess we started with that entry to practice phase. We've now, I think we're probably approaching maturity with our leadership development program component. We have probably about maybe between 6 and 10 people on the leadership development program at any kind of given time. So we sort of have 30 to 35 trainees, 6 to 10 there, and we're still we're only kind of in what I guess technically we're year 3 now, but we've only just started year 3 of RIPA, which is kind of that get them early phase. But even from our 2023 RIPA cohort, we ended up with those students taking either temporary graduate positions where they did their RIPA placement and or have gone into rural generalist training positions, either where they did their placement or within that same HHS. So our initial trial was in the southwest, and it's kind of got 3 major hubs, and so they sort of were drawn back to the southwest for their graduate year, which is just, that's what we're after.
Yeah, thanks, Liza-Jane. And we have bits of the pathway in place. We have a leadership program. We have the work with Flinders Uni with the undergraduate courses. So we have some of the building blocks there already, which helps, I hope.
Definitely.
Thank you very much, Elaine. Any other questions anyone has for Liza? As Liza said, she's more than happy for anyone to reach out. So yes, mull it over a bit, think of it, and yeah, we can contact Liza with any questions later.
Excellent.
Well, thank you very much for taking the time to present today. We really appreciate it. And yes, and thank you for everyone